I'm Catherine, and today I'm going to be showing y'all the anatomy of your upper and lower extremity vascular system. So that's going to be including your arteries and your veins. So I'm going to start with the upper extremity arterial system. So this is the view. It's going to be on your arm, and everything's going to start off with that aortic arch. So this is your left subclavian artery, and that's going to course laterally to your arm. Your subclavian is going to turn into your axillary artery, and then that's going to go into your brachial artery near your bicep. At your antecubital fossa, they're going to split into two or bifurcate into your radial artery and your ulnar artery. Your radial artery is always going to be on your thumb side, and your ulnar artery is going to be on your small finger side. And those are going to turn into your deep and superficial palmar arch. Next, we're going to go over the lower extremity. So for this one, it's still coming off of the aorta where it's starting, but this time it's going to be your abdominal aorta. So from your abdominal aorta, it's going to turn into your common iliac artery. From there, they're going to bifurcate into your internal iliac and your external iliac. We're going to be focusing on the external iliac and the branches off of that. From your external iliac, it's going to turn into your common femoral, which is right here. From there, it's also going to bifurcate into your deep femoral or your femoral artery or your profunda. That's going to go into your popliteal artery, which is right behind your knee. And from there, it's going to branch into three branches. You're going to have your anterior tibial artery, which puts oxygenated blood into your anterior part of your calf. You're going to have your peroneals, which puts oxygenated blood in the lateral side of your calf. And then you have your posterior tibial artery. That's going to supply oxygenated blood into your posterior part of your calf. Now we're going to go to the veins in your arm. So this can look a little difficult at first, but once you really study it, it all makes sense. So we're going to start off with your right brachiocephalic vein. That's going to course into your right subclavian vein. From your right subclavian vein, it's going to turn into your brachial veins. Now these are going to be paired. Your veins, your deep veins pair with the corresponding arteries. So you have your brachial veins, and then carrying on with the deep veins, we have your radial and your ulnar. So we also have superficial veins, and those are going to be your cephalic and your basilic vein. Your cephalic is going to start at that right subclavian vein. It's going to branch off and go all the way down to your wrist, and your basilic vein is going to terminate into your brachial vein. And then now for your lower extremity, we have your IVC. That's going to turn into your common iliac vein, which is going to bifurcate into external iliac or internal iliac. From there, it's going to go from the external iliac, it's going to turn into the common femoral. And from the common femoral, you're going to have branches. So we're going to start with the deep ones. So we have a femoral vein, and we have your deep femoral vein. Your femoral vein is going to turn into your popliteal vein, which is also going to have those branches that are exactly similar to your arteries, except these are going to be veins. We have the peroneals that drain the lateral side. We have the anterior tibial that's going to drain from the anterior side, and we have your posterior tibial that's going to be draining from your posterior side of your calf. For the superficial one, we're going to talk about the greater saphenous vein. Now this is the longest vein in your whole body. It's going to start at your external iliac, and it's going to course all the way down your leg. And this vein is the superficial vein in your leg, the most common superficial vein in your leg. Alright, so now that I've gone through the anatomy, I'm going to be going through two procedures that are commonly used throughout ultrasound. The first one I'm going to be talking about is lower extremity vein mapping. Doctors love to use this before a patient is going to have bypass surgery after having a myocardial infarction or just, a high amount of plaque in your coronary arteries that could cause a myocardial infarction. They like to use your greater saphenous vein just because you have the most options there, and you technically don't need all of the greater saphenous because there's going to have tributaries, and It's going to branch off and make more to drain when it needs to. So first thing we're going to do is we're going to have the patient lie in a supine position on the table, and we're going to be doing the study on both legs. So it's going to be a bilateral study. For this, we're checking the patency of the veins, and we're going to make sure the size is good, and we're going to make sure that there's no plaque, and that just everything looks the way it needs to look, because we want the best vein or best segment we can for this bypass surgery. So we have 8 segments in our GSV. So you can either start from the top or the bottom. Most of the time you're going to start for segment 1, which is right off the common femoral and your GSV, that bifurcation you see, and you're going to work yourself down. What you're going to do for this is you're going to first just do a quick scan through, make sure everything looks right, and then we're going to check to see if it compresses. We need to make sure it compresses to make sure that, one, we don't want to put anything that already has plaque into a place that's supposed to be replacing our coronary arteries that has plaque in it. So we're going to make sure it's plaque free, it compresses completely, and it reaches the right size. Sometimes your patient needs to stand up or sit to do this study to really make sure that your veins are at the biggest they can be. So yeah, we're going to start from segment 1 all the way to segment 8, which is down by your ankle, and you're going to just compress all the way through. You can do a side-by-side, non-compressed, compressed picture, or you can do a cine loop, which is what I like to do, which is just compressing it and then letting go and just having that clip. So you're going to do that all the way through on both legs, and then you're going to go back to segment 1 and you're going to measure all the way down. Different places may have different measurements that they want, so just go by whatever your physician's wanting you to go by, but make sure it's the right measurement, because and make sure you do inner lumen to inner lumen. You don't want to get any outer. You want to make sure that the inner lumen is what you're measuring. So that is what we do for vein mapping. My next one is going to be TEE, or Transesophageal Echocardiogram. This is a echocardiogram that typically a cardiologist will perform, and they're going to take what is called a TEE probe. It's thin and longer, because what they're going to do is they're going to put the probe down the patient's throat. They're going to have a general anesthetic, so they're not really going to be out, but they're going to be asleep enough to where they're not going to be fully awake and experiencing this, because it can be very uncomfortable. And so they're going to put the probe down the patient's esophagus, and they're going to stop around here near your heart. They like to do this because you get a better view. There's no lung interference there. You can get a great view of all the valves. You can get a great view of all the chambers. And the ultrasound tech's role in this is you're going to be the button pusher. You're going to push the buttons. You're going to put color where you need to put color. You're going to Doppler where you need to Doppler. And the cardiologist is going to be the one maneuvering the probe, getting the angles that they need to get. So yeah, and then 2 things they like, that the most common uses for TEE is checking for left atrial appendages, thrombus. We can see this with echo, with transthoracic echo. It's harder to see with transthoracic echo, so if there's any possible thought that there might be one, we're going to be doing a TEE. You can see the left atrial appendage wonderfully with TEE. And the other thing is PFO or ASD, so a hole in between your right and left atrium, because if that's there, we want to clog it, basically. We want to put a little plug right in there to make sure that we can just fix that, because we obviously do not want backward flow going back and forth. We just want everything to work how it needs to work. And yeah, thank you so much.